Do you think you have baldness, but it's not possible for it to be genetic? Do you often wonder whether stress, hardness of water, exercise, diet, or even a change of place might be one of the culprits of your hair loss? If yes, this video is for you. There are many young patients who walk into my clinic, and after I have made the diagnosis of androgenetic alopecia in them, they wonder how is a genetic cause even possible in them, since their fathers have a head full of hair. Well, androgenetic alopecia is called so because both androgen excess as well as genetic factors play an important role in its etiology. I will be discussing about androgenetic alopecia a little later in detail in this video. Since this video is made for hair loss sufferers who may not be doctors, I have used simplified language for better understanding. Let me give you a brief idea about the normal hair cycle and its three phases. In an average normal scalp, there are about 90,000 to 1,40,000 terminal hair, which are coarse, well pigmented, thick hair. And on the other hand, there are fine, less pigmented, fragile hair as well, which are also known as the vellus hair. Now, the thick hair are in the anagen phase or the growing phase, and these are about 90% of your hair on your scalp. On the other hand, there are about 10% of the vellus hair, thin, finer hair, which are in the catagen or the telogen phases. The catagen phase is also known as the regression phase, and the telogen phase is known as the resting phase. The anagen phase lasts for about 2 to 4 years. On the other hand, catagen and telogen phases last for about 3 to 4 months. In a balding scalp, the anagen or the growing phase is shortened and the catagen and telogen phases are lengthened duration. So what happens is that more than 20% of the hair on your scalp are in the catagen and the telogen phases, which leads to a visible scalp, and this could be really alarming for anyone. Gradual and progressive hair loss indicates androgenetic alopecia, or in women, it could also indicate alopecia caused secondary to a disorder known as polycystic ovarian disease or syndrome. These women usually have symptoms of decreased frequency of menses or missed periods, acne, hirsutism or excessive thick facial hair, and they could also have a history of weight gain. Another very common cause of hair loss in women is hormonal imbalance, which occurs due to thyroid causes, intake of OCPs, pregnancy, etc. Most commonly, there are women with hair loss, and the medical condition that they are diagnosed with is hypothyroidism. These women have a typical history of weight gain and of feeling very tired throughout the day. Diffuse and rapid shedding caused due to an emotional or a physical stressor is typical of a condition known as telogen effluvium. In this, hair comes out in clumps, and this is very scary, especially for women. Rapid localized patchy hair loss usually indicates alopecia areata. Frank inflammation in the form of pain, redness, itching, discoloration of the scalp skin, or even blisters and pustules on the scalp skin are suggestive of an infectious cause of hair loss. Now let's talk about androgenetic alopecia. This is the most common presentation you will get to see at a hair transplant clinic. This form of hair loss is a patterned hair loss. So this pattern might be male pattern baldness or female pattern baldness. It is characterized by the process of miniaturization, or in simple words, hair thinning, during which thick, pigmented, coarse terminal hair is replaced by fine, fragile, vellus hair. Like I told you, the anagen phase is shortened in these hair. In men, this condition usually affects the crown region of the head, as well as there is typical recession of the hairline, whereas in women, the frontal hairline or the frontal fringe might be preserved, but there is a diffuse pattern of hair thinning. A metabolite of testosterone known as 5-alpha dihydroxytestosterone, or DHT in its abbreviated form, is the main culprit in androgenetic alopecia. The conversion is caused by 5-alpha reductase, which is an enzyme. This enzyme comes in two isoforms, type 1 5-alpha reductase and type 2 5-alpha reductase enzymes. The type 1 form of this enzyme is commonly found in the sebaceous glands in the skin, and on the other hand, type 2 5-alpha reductase is found in the dermal papilla, the outer root sheath of the hair follicles, as well as the prostate gland. So it is this DHT which acts on the androgen receptors at the follicular level and causes hair thinning. You might have heard that DHT blockers are used in the treatment of androgenetic alopecia, though these are not to be used in each and every patient. In women, the role of androgens is somewhat limited due to the presence of serum hormone binding globulin, or SHBG, which binds the androgens and therefore decreases the amount of DHT. Additionally, there is an enzyme known as aromatase in women, which may decrease the impact of DHT at the hair follicular level. To support the role of aromatase in female pattern hair loss, it has been found that women who took aromatase inhibitors ended up having female pattern hair loss as a side effect. To rule out some of the other important factors of hair loss, one should consider thyroid disorders. There are many nutritional deficiencies as well which are associated with hair loss, but most commonly iron deficiency plays an important role. So if you look pale, probably you have anemia and you should start taking those iron supplements. Women often after delivery end up having hair loss, and this is a condition known as postpartum effluvium. On the other hand, even OCPs or oral contraceptive pills could lead to hair loss. So this is known as post-OCP effluvium. Youngsters who like to hit the gym, beware, because whey protein that is sold by your trainers could be the reason of your hair loss. Any artificial supplements should not be taken by those who are suffering from hair loss. Well, of course, chemotherapy and radiotherapy in patients with cancer sadly causes hair loss in those cancer sufferers, and there are also androgen producing tumors which cause hair loss. There could be certain medications which might be prescribed to you by a doctor to treat your underlying medical condition which might be causing hair loss. These medications include anticoagulants, anticonvulsants, beta blockers, amphetamines, NSAIDs like paracetamol, aspirin, and yes, like I told you, oral contraceptive pills taken by women can all cause hair loss. This doesn't mean that you should stop medication right away. Probably you should consult your doctor and ask for an alternative or a lower dosage of the same drug. Lastly, the important lab test results which are to be considered before coming to the conclusion of your cause of hair loss are thyroid function tests, serum ferritin and HB or hemoglobin levels if you think that you're pale and could be suffering from anemia, and thirdly, DHEAS, also known as dehydroepiandrosterone, and total testosterone levels in women who think that they might be having PCOD. If you found this video helpful and informative, please like this video. Also, if you have any question that you would want to ask me, feel free to do so. I would reply to you as soon as possible. Thank you.